Good evening. We're here with Dr. Joseph Philbin, MD, also with Alpha Medicor Health Group, who we have the privilege of working with Dr. Philbin. Dr. Philbin, you've been with us for just coming up about 2 years. Can you give us a little bit of your background, your specialty, and what made you start treating patients with addiction?
George, I was an internal medicine physician, still am, for 30 years in the Scranton area, and it became clear to me the scope of this terrible problem we're having with the opioid addiction. It's the effects it's having across all people, whether it's children, adults, rich, poor, and I really wanted to try to do something about it, and was fortunate enough to find this program and have been extraordinarily rewarded by the work that we've done here, and I think the people that we've helped.
Fantastic. What's the biggest difficulty that you have with treating somebody with opioid dependency, specifically, as a clinician, as a physician? What do you see as the most difficult?
I think the most difficult thing is maintaining your sobriety, so to speak. People have done for years, rehab, come out, and I think what a lot of people forget is that this is a disease. It's a chemical problem, and you need to titrate the medicine. Suboxone, which is a combination of two medicines, is what we use as a mainstay. And what that does is it blocks the receptors in the brain. So your challenge is giving people enough to keep them from having urges or cravings for the drug, and maintaining their lifestyles. I mean, their healthy lifestyles, I should say. That is the biggest challenge that we face.
Now, with dealing specifically with Suboxone or any opioid dependency, are all physicians the same as far as the level of treatment that they receive here at Alpha Medicor? And what's your opinion on, there's a lot of other doctors out there. What would you tell a loved one if they're looking for good treatment? What does that look like to you?
Well, Alpha Medicor is a group of people dedicated to help. We have counselors, we have social workers, we have physicians trained in the use of the drugs that treat opioid addiction, specially trained, specially licensed. So the clinic is the whole package. It's not going somewhere and being handed a prescription and hoping you come back in 2 weeks. We're really dedicated to the patients. We form a relationship with the patients. We feel happy together when they're doing well and they're staying well and they get their lives back in order.
That's awesome. Fantastic. In closing, if there's a patient that's viewing this on the website, which this is kind of like a meet the doc episode, they're scared to go out and get treatment. They're scared to make that call. If you could talk to that patient, what could they expect when they see you?
Well, first of all, they can expect no judgment, first of all. We know here that this is a disease that affects everyone. Rich, poor, as I said before, young, old. And I think a lot of people are fearful of getting into treatment because they feel it'll give them a stigma. But, we know from experience that people who are addicted, or their lives are controlled by their addiction, their finances are controlled by their addiction. They wind up losing jobs, losing marriages, unfortunately sometimes going to prison. And that's the road a lot of people are on. And when it's time to take the step, again, you need to go someplace where, as I said before, you're going to have a comprehensive care program and people that are going to care for you and care with you and work with you to get better and stay better.
Fantastic. Dr. Philbin, thank you for your time tonight, and there'll be more episodes, hopefully, with Dr. Philbin. Meet the Doctor.